welcome back to my channel. I'm Dr. DuPont. I'm a board-certified gynecologic oncologist, and today I want to talk to you about what gynecologic oncology is, why I chose it, and what we do. Well, if you're new here, welcome. I'm Dr. DuPont, and I love educating women on how to lead healthy and productive lives, and I believe that begins with great health. If you have not subscribed, please click the button below to subscribe. Well, in the U.S., this is kind of the process that we go through to become a urogynecologist. So we go to high school, and then after high school, we go to college. We go to college for 4 years. Then we apply to medical school. Once we are accepted into a medical school, we are there for 4 years, and then we choose this specialty. So I chose obstetrics and gynecology, or OBGYN, and we do that for 4 years. And then after you finish your OBGYN training, you can go out and get a job, or you can do a subspecialty. So I chose to do the subspecialty of G1 oncology. There's a few other subspecialties of OBGYN. Common one is urogynecology, or female pelvic medicine and reconstructive surgery, or urogynecology. There's reproductive endocrinology and infertility. Those are doctors who try to help women get pregnant who are maybe having troubles. There's the maternal fetal medicine, or high-risk obstetrics, or perinatalology, for women that are, having high-risk pregnancies. Those are doctors that specialize mainly in high-risk obstetrics. So for G1 oncology, we do a fellowship for 3 to 4 years, and then we take exams to get board certified. Well, I chose G1 oncology because at my medical school, I was chosen, well, wasn't really chosen. I was given a subspecialty rotation during my 3rd year of medical school, and we didn't really get to Actually, it was my 3rd year. We didn't really get to choose, and I was, put on the G1 oncology service. I didn't know much about it, but I had a wonderful teacher, Dr. Charles Capon. He's now retired. He was one of those professors that was just a great teacher. Everybody loved him. He was always getting awards, and I really loved what he did. And so that's why I chose G1 oncology. Well, what do we do? So a gynecologic oncologist is a doctor that treats women's cancer. So we traditionally treat, 5 main cancers: uterine cancer, ovarian cancer, cervical cancer, vulvar cancer, and vaginal cancer. Now we'll do a few other cancers such as gestational trophoblastic disease. It's very uncommon, but it's another disorder that we treat. We also treat complex gynecologic problems, so we're great gynecologic surgeons. We also treat women with high-risk cancer syndromes such as the breast and ovarian cancer syndrome or Lynch syndrome. So we talked about why I chose it and what we do. Who needs to see a gynecologic oncologist? Of course, women who have a gynecologic cancer, most of those women should be seen by gynecologic oncologists. Now, we're not in all small towns, and so there are some areas where there may not be a gynecologic oncologist, and sometimes you may see a medical oncologist and a general surgeon. But for the most part, we do treat women with those kind of 5 main cancers: ovary, cervix, uterine, vulvar, and vaginal cancers. And we also see patients for a second opinion. So let's say, you had cancer, you're not sure if you're on the right treatment, or you maybe want to know if there's a clinical trial available, so you would see a gynecologic oncologist. We also see women who are at high risk for cancer. So, I see many patients with BRCA1 gene mutations or BRCA2 gene mutations, and so those are patients that are at high risk for cancer. We don't want to wait till they get cancer. We want to prevent it beforehand. So there's a lot of things now that we can do to prevent some women who are at the highest risk for getting cancers, and those patients would see a gynecologic oncologist. Now, sometimes a GYN doctor will refer you to a G1 oncologist just because maybe you have a complex case or they want another opinion. And so I did do a video on referral to a specialist. Please check that out. I think you'll find it very helpful. So those are the patients that really need to see a G1 oncologist. So we do have a society called the Society for Gynecologic Oncology, and it has a physician locator on it. So if you go to our website, sgo.org, it'll have find a physician near you. You can just put in your zip code and it'll find a physician that's closest to you who is a gynecologic oncologist. We also have a great resource called the Foundation for Women's Cancer. They have a lot of great educational materials for patients and family members of women that have gynecologic cancers, and so that's a great resource. Please check it out at foundationforwomenscancers.org. Well, I hope that was helpful, and I hope you kind of know now what a gynecologic oncologist is. And thank you for watching to the very end. And if you haven't subscribed, please click that button below, and I'll see you in the next one. Thank you for watching. Bye-bye.